Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Okay, so I welcome one and all for the class tonight. It's a class on specimens, and as per special request by my students undergoing the practical exam. So let me start the class. I want everybody to participate. I want everybody to write down so that you also are able to speak in front of your examiners. Obviously, I know all my students, this batch is very, very shy. They don't like to speak in front of me, but you can at least write down. Okay, so try to answer with me when you can see the specimen, because then in that case you'll be kind of preparing for your exam. So let's start with the first specimen. I've tried to make them very simple. Can you see? What would be your language? I would want to see your language when you write down what exactly is the specimen of. Yes, come on guys, you can start. And obviously you will not get so much time in the exam, so you've got to be faster. Yes, it is, of course it is, but what and how will you speak? What will you say? It is hydrocephalus, yes, but that's the way. So here I've said image, but actually it should be a specimen. You can say like this also. This is a specimen of a neonate. Sorry. This is a specimen of a neonate with grossly enlarged head circumference, probably due to hydrocephalus. The scalp is stretched and thin, revealing prominent veins. Or what we can do is this way. Okay, I can just skip this. Specimen of a neonate with grossly enlarged head circumference. The scalp is stretched thin, revealing prominent veins. The cranial sutures appear widened, suggesting increased CSF accumulation. Facial features appear normal, no visible midline defects or cleft abnormalities. Rest of the body is proportionally smaller compared to the head, which is characteristic of a long-standing congenital hydrocephalus. So this is most probably a specimen of hydrocephalus. That's what you're going to share. That's what you're going to write down. You will say the specimen is showing a grossly enlarged head. The head circumference is enlarged. Scalp is stretched out, revealing prominent veins. Cranial sutures appear widened, most probably due to increased CSF accumulation. Facial features are normal. Also, you have to specify that because there's no obvious abnormality apart from enlarged head, which we can see. The body is proportionately smaller as compared to the head, and there are no visible midline defects, most probably suggestive of a congenital hydrocephalus. Long-standing, short-standing, you don't have to specify, but most probably a congenital hydrocephalus. That's the way you'll speak. So you'll first tell me what all can you see and why are you thinking is it hydrocephalus, right? So the possible causes could be that will be the next question. So why do you think? What are the causes of hydrocephalus? So there is congenital hydrocephalus, sometimes because of certain infections, sometimes because of hemorrhage, sometimes because of just other reasons. So one is due to aqueductal stenosis. Actually, that is the most common cause. Anencephaly malformation, Dandy-Walker syndrome, both of which they have this problem of aqueductal stenosis, but that's not the only blockage. You can have a blockage of aqueductus sylvius as well. Okay, you must have heard foramina of Lashkar Mijindi earlier on, but there are two very important aqueduct. One is sylvius, one is your aqueductal stenosis. So they are equally and very important, most probably in Arnold-Chiari malformation and Dandy-Walker syndrome. Apart from that, you also have this in many other infections like toxo, CMV, rubella, yes. So that they also be correlated. What is the clinical correlation? So you have excessive head growth, bulging anterior fontanelle, sunset eyes, irritability, poor feeding, delayed milestones, and a lot of dystocia during birth, even if you plan off second trimester termination of pregnancy or whenever you find this as a termination of pregnancy. Now, this is just easy quiz questions we've just kept to make you engaged in the class. So the most common cause of congenital hydrocephalus is the aqueductal stenosis. Okay. Then you have which clinical sign in neonates with increased intracranial pressure? It's the sunset eye sign, which is most common. The gold standard imaging modality for diagnosing hydrocephalus is definitely the cranial ultrasound. MRI is gold standard. Ultrasound. See, the reason of why we need MRI is because we also can see the blockage, where the blockage is. All right, so MRI becomes the gold standard, but cranial ultrasound is very good in screening it, diagnosing it, and then the confirmation is with MRI. And that also sometimes tell you which is the place from which the the pressure started building up, so we can get to know the place where the blockage is. Okay. Which shunt surgery is commonly performed in hydrocephalus? It's the ventriculoperitoneal shunt. This is one of the intra-abdominal procedures, the fetal therapy procedures which we do, fetoscopic. Name 2 torch infections, which I already told you. Toxoplasma and CMV are notorious in causing congenital hydrocephalus. And here's the next one that everybody will be able to answer, but I just don't want the answer. I want a little more. How will you describe this? Yes, guys, I'm waiting. Yes, Deba, very good. Very good. Excellent. Aqueductal stenosis is a question, is a thing which is expected of you, but not a very common thing. So if you know it, very good. Very good. Excellent answers now. Very good. Very good. I just don't want anencephaly. Anybody can identify it as anencephaly. I'm questioning is why. How will you describe this specimen? Okay. You will describe this specimen in toto. Everything that you can see over here, you will describe. The most, startling fact will be the first one. The abnormality will be the first one, and then you can describe the remaining. The remaining body is probably showing preservation changes. It is yellowish because of being kept in formalin, and grossly the body looks. Grossly the body looks structurally okay. The head looks malformed with so and so. The first leading statement should be, how is the head looking? Okay. Absent cranial vault with frog eye appearance. Excellent. Very good. Excellent. Very good answers this time. So this, actually, it's not the image, I'll say. The specimen is preserved anencephalic fetus stored in formalin. This I'm going to skip because that's not the right way to start. The cranial vault is missing. Okay, this is a specimen of a fetus. Let me start with this. Let me just start with this. This is a specimen of a fetus with cranial vault missing. Okay, there are certain cranial features exposing the undeveloped brain tissue. Okay, eyes appear large and bulging. The nasal bridge is flattened, giving a distinct facial appearance. Mouth appears slightly open and the lips also seem underdeveloped. Ears are abnormally positioned due to lack of skull formation. Head appears small with an abrupt end at the forehead. Prominent orbital ridges which further emphasize the bulging eyes. Spine appears, spine I'll not say because you can't see over here. Limb appears normal, but in some cases there could be joints, and due to reduced fetal movement, that is okay. Umbilical cord remnant is also visible at the lower abdomen. This looks like a specimen of anencephalic fetus. Okay, preserved specimen of anencephalic fetus. All because these certain other changes are because of the preservation. So this looks like a preserved specimen of anencephalic fetus. You are saying this after you've said everything. Okay. So did you see that I also described the body features? Okay. The ears are abnormally positioned. Head appears small. Prominent orbital ridges. The joints are looking small because of the reduced fetal movement. Umbilical cord remnant is also available, and there is also a scar mark if you can see over here. Probably, I don't know, because of is this just a artifact, or is it look like a suture line? But this is a full grown fetus, right? This is not a very small fetus, so most probably it was a post-mortem, but you don't really need to do that because it's an anencephalic baby. It will not survive anyways. Okay, anyways, so this could be the reason of the suturing, probably the midline scar. But yes, this is how you will describe that this is a specimen of a fetus with the cranial vault missing. The eyes appear large and bulging. Nasal bridge is patterned. Mouth appears slightly open. Lips are underdeveloped. Ears are abnormally positioned. Prominent orbital ridges. And umbilical cord is remnant. Looks like a preserved specimen of anencephalic fetus. The pathophysiology behind this is that there is a failure of the neural tube. Just a minute, guys. Anencephaly occurs due to the failure of the neural tube to close at the rostral, that is the cranial end, during the 3rd and 4th week of gestation, that early on, okay? And that leads to the absence of the forebrain, the absence of cerebrum, preventing any higher cognitive functions. There is a failure of skull bone formation, causing a brain exposure and slightly degeneration because of the direct contact with the amniotic fluid. Brainstem may be partially intact, allowing just basic reflexes, but no higher neurological functions. Such babies do not survive. Let me tell you that. No matter how long you keep them in the fetus, they'll keep growing, but they will not survive till the end. So it's not compatible with life, right? Results in the stillbirth or death within hours or days. It'll keep growing. It'll keep growing till the end. So heartbeat will stay, but it can, die any time in the womb or immediately after the birth. Folic acid deficiency is the most important deficiency. Maternal diabetes, genetic predisposition. Ultrasound at 11 to 14 weeks usually will tell you that this is absent skull and absent brain, and you want to prevent it, just take folic acid. If a patient had a history of previous anencephalic baby, then in that case, you have to give her high dose folic acid supplementation, which is 5 milligram. Otherwise, the normal basic folic acid that you give to everybody, that is 400 microgram, that you will supplement. If you're having folic acid, most probably this is not a problem that can happen to you. Okay, so just an easy few questions. What is the primary cause? It is just the failure of the neural tube closure during early embryonic development. Which structure fails to close? It's the rostral cranial neuropore to prevent the proper brain and skull formation. Why do anencephalic fetuses have bulging eyes? Because of the absence, of the entire this area the frontal bone is not properly formed. Is it compatible with life? No, it is not compatible with life. They die. And how can it be prevented? By taking folic acid before conception. At least 2 to 3 months before conception. Guys, any question, anything you want to add, let me know right now.